So you're probably all sitting here too wondering, like, what am I doing here? Why am I here? There's things where you're sitting in a seat, you have a desire to be here for some reason. And for me, if I'm thinking about understanding something, what I want you guys to come out with today is a good understanding of what this conference is, what the future of this conference can be, and hopefully be inspired, as I said earlier, to look at 2027 and 2028 and beyond, and to see the void that a conference like this can fill in a city like Grand Rapids that we have a lot of healthcare in. But are we looking at healthcare in its truest form, I would say, as healthcare, not necessarily sick care? And so for me, we'll start with the 5 W's. If you write a good story, you always say, who, what, where, when, why. Following Simon Sinek's start with the why. Let's start there and go through. So why did I even think about this conference in the first place? Why was this a thing? Why was this a thought? And it really came from all the conversations that I was having with many of you, conversations I was having with others on social media, things that we're seeing in the market, really identifying where we're going as a healthcare system within the United States, and saying, why are we not talking about this side of healthcare more? We have an extremely robust healthcare system in the United States, but is it producing the outcomes that we want? Is it making our populations healthier? Is it driving towards independence and autonomy? Is it empowering the patient? Is it providing transparency with what we're asking for? And if we sit back and we ask ourselves why, like why is it not, or why is it? I think we can clearly see that there's a side of the industry that's being completely left out. And so as I'm looking at healthcare and saying, how do we create a parallel healthcare economy? How do we create an ecosystem of independent providers that aren't just out here fighting each other in competition? A lot of times we create businesses as entrepreneurs, and then we say, hey, now I got to find who my competition is, and I got to try to go out there and beat them. There's enough fish in the sea. I think we can all acknowledge that healthcare touches everyone. Being healthy, seeing our bodies as our best healers, is something that we can all live and breathe every day. This is not someone else's problem. This is everyone's problem. And how do we embrace that and really promote and perpetuate that conversation of this other side of healthcare? If you think about today too, where do you go to find alternative solutions? We have many exhibitors and vendors in this room, sponsors of this event. Where do you go to find them right now? You might look at AI, you might Google it, but where is the place for them? And a lot of times, because those independent solutions are not structured into referral pathways for larger healthcare organizations, and as these larger and larger healthcare organizations consolidate and get larger, the funnels get shifted further and further over to what's within network. And so how do we break networks? How do we provide independence and clarity? And a lot of those questions I ask myself, and that's why I wanted to start this conversation, really this conference, is to provide a voice, provide a platform and a forum for these independent solutions to have a say in the healthcare narrative, to come together, not to see others in this room. There are other like solutions exhibiting next to each other, represented here, not to see each other as competition, but more so of how do we collaborate together to create something better? I had a 13-year career in the healthcare system. I was an ER nurse, and I eventually became a director. And I tried to reform the healthcare system from the inside. But as you can imagine, one person on the inside and many people on the inside trying to do the right thing and finding that doing the right thing is extremely hard sometimes when there's a business model and a juggernaut that's barreling down in one direction. And so how do you change that? And we could spend more and more time trying to change what our current system is, and we need to. We can't stop trying to improve upon opportunities, but my approach is to build and to create and to dream and to vision what something new can be, and how do we enter this white space that I think exists where we're all kind of playing right now in. We're all over here on the outside of the healthcare systems, and sometimes some of us, our solutions aren't even recognized as healthcare. You look at certain things and you're like, well, those are just, nutrition, and that's dietary stuff, and this is lifestyle medicine. This really doesn't matter, right? This isn't healthcare, right? Healthcare is sexy. You got medications and surgeries, and we do really cool advanced things. That's all great, right? Like, we need those things. I want a really good surgeon if I have to have surgery. I want to trust my medical system, but I want to also work just as hard, if not harder, to prevent all these things from happening. And where do I go for that when primary care has become a funnel point for a health system where you only get to spend 5 or 6 minutes with your provider and only talk about one chief complaint, and then on to the next patient? Where do you go for those types of things? And so I see healthcare as a conference and as a movement growing, in that we're providing structure to really a lot of white space out here in the system, and bringing our solutions together to have shared conversations about what healthcare can actually look like, what true healthcare can actually look like. So what is this, right? I think this is a parallel healthcare economy. I think this is an economy based off of cash-based payments. I think this is an economy based on incentives that drive healthy outcomes. I think this is a true parallel economy that incentivizes entrepreneurship and business ownership, and really shifts the pendulum from consolidation and system ownership to independence and patient empowerment. Now, the bones of this are just being created. This does not exist right now in any structured way. I think we can learn a lot from what our traditional healthcare systems have done. We don't have to recreate the wheel. The business model of healthcare as it currently exists is operating as it was intended to operate. The outcomes we're getting today are how the system was built. This is not an accident. People are like, I don't know how we got here. We got here because of decisions being made, and decisions being made based on, unfortunately, a lot of times, financial outcomes and incentives. The business of healthcare has taken over. And so how do we shift, and how do we guard ourselves as we create this parallel healthcare economy? How do we guard ourselves from falling into the same traps? And so this is what I think the healthcare conference and really this healthcare movement can become. Who? This is all of us in this room right now. It's you, it's me, it's your friends, it's your family. It does not have to be a clinician or a business owner or someone else who's healthcare employed. This is everybody. This is not, we got to quit thinking about healthcare as someone else's problem, as, hey, I can do whatever I want in my life, and I'm just going to go receive care after I get sick. We have to own healthcare. The conversation around this is much broader than just businesses and solutions and other things in the market. This is every one of us living and breathing this and using that point of influence to create change and to really be the ripple effect that occurs. I'm a huge believer in being the change you want to see, right? So if somebody said, hey, Nate, you're thinking about this really cool thing, this parallel healthcare economy in a conference, and my perspective is, okay, well, I'm just going to go ahead and do that. So I'm bullheaded, and I move forward, and I'm not afraid to fail. And that's where I think being able to just take charge and move forward, but we have to all be doing this. This can't just be me. This can't just be any one of our solutions. This has to be every one of our solutions working in tandem and in collaboration with a shared vision for this future. And the work that we're doing right now, and after you leave today, you're going to hear from functional medicine specialists and lifestyle medicine specialists, and you're going to understand what health can be, right? And not just sick care. We could spend all day today talking about the most complex surgeries or the newest innovation in medicine. But is that really what we want to be focusing on if we have a population health crisis and we have a healthcare cost crisis? Do we want to be adding the next latest and greatest thing? It's fun. Again, it's fun. It's sexy. It's great to put on a billboard. What do people not talk about? Primary care, lifestyle medicine, nutrition, health optimization. This isn't just biohacking, right? Like biohacking's cool, but we want to make that available to everyone. We don't want this to be a thing for those who have the financial means to do it or the time to do this. We need to make this a part of our culture. And so I think for me, this conference and this narrative is not just us in this room. I think it's everyone in our communities, and we have to start thinking about it that way if we want to make a real dent and difference in what we're doing. Where this does not just have to be in Grand Rapids. I love this city. I love what West Michigan represents. I think the business community here, as evidenced by you all, turns out when there are awesome things happening. We're here to support each other, and I don't know if this would have happened in any other city. So it's pretty incredible to take something from 0 to 100 in 6 months and have this be the turnout. So I think it's a testament to the incredible nature of West Michigan and the business community that we have and the unique opportunities that represents. But this needs to happen everywhere. Like, I want this to be a catalyst. I want this to be the kind of the generation of the conversation, but this doesn't just have to stay here. Let's take this everywhere. So there are broader conversations to be had in any community, not just affluent communities, not just urbanized communities, but rural and non-affluent communities. How do we get to some of those marginalized and really make solutions for them as well, not just for the haves, but also for the have-nots. And then when, we talk about with this, we always want to wait for things. It's always, we'll just do that later. We'll just, it's not now. Like, there's going to be time for that. I don't think we have time anymore. I think we're there. We have to do something now. I don't think if anybody's ever, if you're watching the healthcare narrative at all right now, you quickly realize we are in a massive healthcare crisis in this nation, and it's affecting individuals and businesses. It's affecting our family members. It's impacting every element of our lives. And so we can't just keep saying, well, maybe next year, or maybe next year, let's wait for this, let's wait for that. It has to be now that we're going to take advantage and really take the reins of this opportunity. This can't be a conversation you put on someone else. This has to be a conversation you own yourself, and you live and breathe it every day. So now is as good a time as any to really kick this off and see, I think, what the future of healthcare can be, not just for West Michigan, but beyond. And how do we create this parallel healthcare economy that incentivizes entrepreneurship, that incentivizes healthy outcomes, that works towards a better future. This will not be something that we probably see the fruits of our labor in our lifetimes, potentially. We are so tied to immediate gratification, and we want to see the results right now. If we don't see the results right now, then we abandon it. This is going to be a grind. This is something that our children will be impacted by, but it is something that we have to do, and we have to stay in for the long haul. And so please don't get discouraged in doing the work. It is meaningful and very, very necessary. I want to thank you all again for coming to today's conference. Hopefully you have a better understanding of the why behind what we're doing, a better understanding of the mission that we're on. And I am, so I was talking about next year already. Somebody was like, you just got to get through this year first. Talking about next year, I think we have we will have a healthcare 2027 next year. I think we'll have a larger conference, and in my dreams, I think what does this look like if we built this thing out to be Health Week 2027? So, thank you.